Welcome to Middlesex London Health Unit. In this video, Middlesex London Health Unit will be discussed in terms of computer security concepts and the legislations under which it's operating, the recommended practices when dealing with personal information, along with the importance of maintaining these information will be elaborated. Middlesex London Health Unit is mandated under the Health Protection and Promotion Act to provide public health programs. Our work is guided by Ontario Public Health Standards to set out the minimum standards required for healthy environments and positive health practices. Our vision articulates what we would like our community to achieve over the long term. Our mission is the declaration of our core purpose that will contribute to the vision, and our values are the beliefs and principles that will guide us. The Middlesex London is located in southwestern Ontario. It has 8 municipalities and 3 First Nations communities. It has a population of more than 400,000 people. The City of London is the 6th largest city in Ontario. The majority of the population are young adults between 15 and 29 years old, and it has a lower children population. The Aboriginals represent 1.6% of the population, whereas the visible minorities account for 12%. When looking deeply into the Middlesex London, several social determinants appear to affect the health of the population. The first determinant to consider is the employment. In Middlesex London, the unemployment rate reached 9%. This can be related to the educational level, where more than 20% of the population did not complete high school. The residents are more likely to have a college certificate. The family structure is determined by the marital status. In Middlesex London, over 15% of families are headed by single parents. Half of the population are married and about 11% are either separated or divorced. The household's median income is around $55,000. It is higher for couples with children. Based on this analysis, we at Middlesex London Health Unit address the public health issues that can affect you, your family, and your neighbors. We promote healthy living and identify community needs. Our staff work in schools and immunization clinics. They work with families to support their needs. They also inspect restaurants, swimming pools, tattoo shops, nail salons, spas, and more. They also provide dental services to people who need them. In terms of safety culture and computer security, we will demonstrate how Middlesex London Health Unit protects the confidential information against any breach. Computer security is defined as the protection of process to the information system resources to preserve the data confidentiality, availability, and integrity. Computer security integrates 3 security concepts. Confidentiality is the first concept that aims at protecting data against any damage or theft by restricting the access to authorized users. Unauthorized disclosure of sensitive information is considered break of confidentiality. The second concept is availability, which ensures that the correct person can access and use the information at the correct time. Integrity is the third concept that ensures protecting information from improper modification or destruction. It also ensures the authenticity of information. Within this aspect, differentiating between data integrity and system integrity is critical. Data integrity pertains to maintaining the information during its entire life cycle while ensuring data accuracy and consistency, while system integrity is the operational methodology to protect data integrity, including hardware and software. As employees at Middlesex London Health Unit, we will discuss how we shall manage the information security at our organization. First, it is important to know that the information security is a shared responsibility. Therefore, everyone in the organization shall take the ownership in protecting health information. Developing a security awareness life cycle and providing the appropriate trainings related to threats management and prevention increases security awareness. Another strategy of managing information security is through applying strong passwords to all computers and periodically changing them. Following computer security measures, it is important for our employees to understand the legislations under which Middlesex London Health Unit operates. First, we will start with the federal legislation that is related to data privacy in the private sector, the Personal Information and Electronic Documents Act. The purpose of this act is to govern the collection, use, and disclosure of personal information in a reasonable, appropriate, and lawful ways. It gives individuals the right to protect their personal information and authorizes the provincial legislations to establish their own regulations. Beyond PIPEDA, the Personal Health Information Protection Act is the act that outlines regulations and sets the rules for the collection, use, and disclosure of health information by health information custodians. It provides patients with the right to access and correct their health record and imposes administrative regulations on custodians with respect to personal health records. In terms of quality, the Quality of Care Information Protection Act enabled healthcare professionals to discuss confidential information that are related to errors and systematic problems to help improve patient safety and the quality of healthcare delivered to patients. The last legislation is the Freedom of Information and Protection of Privacy Act, which provides the right for everyone to request access to government health information, including general records. The Act mandates a privacy protection scheme to protect an individual's right to privacy. By complying with legislation requirements, the Middlesex London Health Unit operates by continuously developing mature policies and programs related to operational planning improvements, culture security, privacy and confidentiality, information management, and data integrity. As an employee at Middlesex London Health Unit, it is important to identify the recommended practices and the forbidden ones in terms of personal health information. All our healthcare professionals have the right to collect, use, or share personal health information as a professional obligation. They should adhere to confidentiality policies and seek guidance from managers or health unit privacy employees whenever needed. If any breach of confidentiality occurs, it is extremely important to refer the breach to managers to seek for solutions. On the other hand, never share any personal or health information with any family members or persons who are not healthcare custodians without the patient's consent. Do not disclose children's health information to patients who are not legally responsible for the children, and never share patient's health card number with any other institution without the patient's consent. Obtaining consents from the patient is one of the mandatory practices that is required by all healthcare professionals. These consents are agreement between the physician and the patient about a provided treatment or procedure. In this aspect, several types of consents arise. An implied consent is the one concluded from the patient's action or condition. In contrast, the expressed consent is obtained after an explanation is given to the patient, whether verbally or as a written document. The third type is the third-party consent, which is provided by the patient's legal representative or next of kin. The fourth type is the individual consent that is related to a particular treatment as receiving anesthesia. Finally, the informed consent, by which the patient is provided with detailed information about the risks and benefits of the treatment. So, what are the recommended security practices intended to protect sensitive personal health information? To maintain confidentiality, our unit develops security programs in consistency with the legislation acts. This is accomplished by supporting the Board of Health and the senior leadership team to identify, monitor, and resolve organizational risks. Moreover, we facilitate activities to enhance the unit's compliance with the applicable privacy laws and reduce the occurrence of privacy breaches and incidents. To maintain the privacy, we regularly monitor the adoption and use of our programs and evaluation frameworks related to the collection and disclosure of personal health information. We train our staff on privacy breach investigations, responding policies, and the mandatory reporting to the Information and Privacy Commissioner's Office. In terms of risk management, it is important to improve and implement organizational risk management plans that are capable of distinguishing and evaluating the risks. Information security is a shared responsibility. By adhering to Middlesex London Health Unit security standards, you help in building a strong security culture that protects information. For further information, please refer to Middlesex London Health Unit Security Policies. Thank you.